Good evening, everybody. I'm happy that you're here to join me tonight for YouTube Live. I'm Dr. 𝗪𝗲 𝗏 the medical advocate. And tonight, we're going to make a little change. We're going to talk about a very common problem known as palpitations. Now, the last few weeks, we've been talking about certain arrhythmias or rhythm disturbances like atrial fibrillation, which is the most common arrhythmia in those over the age of 70. We also talked about how to work up a cardiac patient with various testing, or a patient with a potential cardiac problem with stress testing and lab testing and coronary artery calcium scanning. And then last time we really honed in on the laboratory diagnosis, what a functional cardiologist looks for. But today we're going to look at something called palpitations, which is one of the most common problems that patients have when they present to the cardiologist, but not just to the cardiologist, also to the family practitioner or primary care doctor, and also the emergency room. That can be a pretty costly thing because palpitations means different things to different people. Now, I tried to find a very good definition, and I couldn't, so I made it my own. And so to me, palpitations, it's an awareness of your heart beating. It's that simple, an awareness. And normally you don't feel anything, right? Your heart's working 24/7. I think it's like 100,000 beats per 24-hour period. You don't feel anything, no matter what you're doing, exercising or resting, eating, sleeping. But when you start feeling it, when you're becoming aware of it, then it's becoming known as a palpitation. But how do you experience it? And this is really interesting for me because, believe it or not, I've never experienced a palpitation. Can you imagine that? Now, it doesn't mean I've ever had any irregular rhythms or extra beats. I just have never felt them. So I have to carefully listen to my patient as they explain to me what their symptoms are. And so some of what I'm looking for are things like my heart sometimes it's fluttering, or it's skipping beats, or it's racing, or it's going slow, and then I feel a little thump. A woman today that I saw with palpitations said she felt like she has a big butterfly in her chest. So you name it, I've probably heard it. It's just some type of awareness that something is wrong. And although palpitations can be worrisome to the individual patient, fortunately, most of them are benign and don't have a problem. And that's important to keep in mind. Now, so what are the causes? Because, as a functional medicine doctor, I want to know what's causing it. What can I do about it? And what always comes to mind first is a strong emotional response. It's like panic attacks, for example, fight or flight. And this often brings patients into the office of a cardiologist. And I will tell you, over the last year with COVID-19, there's been a surge of people with panic attacks. People are staying home. They're unable to go out. There's nowhere to go, nothing to do. They aren't playing sports. Gyms aren't open. The usual outlets that we have are no longer available to us, or haven't been. So it's just this whole situation now that's opened up, that's allowed us to have more time, screen time, and time to have these palpitations and these worrisome panic attacks and so forth. So that's a big one, is panic attacks. Depression, and also strenuous exercise. We think of exercise as being really good for the heart, and it is. But sometimes strenuous exercise can precipitate an arrhythmia. I have a good friend. She's an esteemed chiropractor and also a Latin ballroom competitor. And I mean, as a dancer, as a competitive dancer, you really can't afford to fall on your feet, right? And she was having symptoms while she was dancing, and we did a stress test on her, and lo and behold, she had a major arrhythmia that needed to be taken care of. So strenuous exercise can be a cause. Stimulants are a big one. Caffeine, nicotine, amphetamine, cocaine, of course, but also don't forget about certain cold and cough medications. That's really important. Like they contain pseudoephedrine, which can precipitate palpitations. Fever, when your temperatures increase, your heart rate will increase along with it. Hormonal changes are a big one, and I see that a lot. And this can be associated with pregnancy, with menstruation, and also menopause and perimenopause. And this is something I want to share with you. For years, as a young cardiologist, a few years ago, people would come to my office, middle-aged women, and they would be complaining of palpitations. And I asked him, has it been going on for a long time? No, it's only been like 2 or 3 years. I mean, you haven't had this for like 15, 20 years? No. And I just, couldn't figure it out. I went to the textbook. I tried to research it, and I didn't come up with good answers. I would do the necessary testing, but I could not figure out what the problem was until I did my anti-aging medical fellowship. And what I learned in the 21st century is that hormonal changes, specifically low progesterone. Now, estrogen is a hormone that gives women vitality, energy. It's important for cognitive function, also libido. But progesterone does more than just spare the uterus of cancer. It's very important. It actually is the calming hormone. It has Zen-like properties. And when patients go through menopause, women go through menopause, the first thing they lose is progesterone. And that's usually in your late 30s or early 40s. And it can be a precipitous drop. And they can become very symptomatic and have, besides just the major palpitations, they can have also migraines. So you give these people progesterone, you become their best friend. It was that simple. So it actually took my anti-aging medical fellowship to teach me what I didn't learn in my cardiology fellowship. So that's pretty important. Okay. Another big one is thyroid hormone. You always have to check the thyroid hormone in these patients because a hyperactive thyroid for sure can lead to arrhythmias. Also, adrenal dysfunction. I'm a big adrenal person. Adrenal dysregulation. And there's different stages of adrenal. I call it dysregulation because the first stage really isn't fatigue. It's actually hyperactivity with cortisol. And that also can lead to palpitations. Also, certain digestive issues, GERDs, acid reflux, gallstones. They've all been associated with palpitations. Also, certain foods. And this really depends on the individual person. What may cause one person palpitations may have no effect on another. But actually, spicy foods can do it. And high sodium processed foods, and especially things like MSG. And also low blood sugar and low blood pressure, because your body does go into a natural fight or flight situation when the blood sugar drops real low, when you have a hypoglycemic reaction, or when your blood pressure drops. So the heart rate will increase, and it can be bothersome in such cases and lead to palpitations. So those are the causes. Now, what about the risk factors? Can we pick out certain people that you would think of having this problem? And yeah, highly stressed individuals, people that have a history of panic attacks. And I had an 18-year-old today come in. This poor gentleman he's a high school student. He starts off with a rush in his head, and then he's going to go into full-blown shortness of breath, palpitations, chest pain, a myriad of symptoms, all triggered by stress and not knowing how to deal with that stress. We'll talk about how to deal with it in a minute, but that's the first trigger I look for. People with anxiety disorders, pregnant or perimenopausal and menopausal female, and certain medications. Again, certain medications include the cold suppressants I'm talking about, certain asthma medications or bronchodilators. They tend to increase your heart rate. And also certain antidepressants, the older antidepressants. We used to call them tricyclic antidepressants. They're not really in vogue that much anymore, but there's one that I think is still being used called amitriptyline or Elavil, and that can cause an increased heart rate. I've had a patient in the past, her resting heart rate was like 108. Which I don't think it's good. And I'm pretty sure it was related to the medication. When we stopped it, it went away. Of course, overactive thyroid gland. And let's not forget about heart problems. This is this is usually the not so obvious part. We're looking for the heart, but usually it's these things are benign. But heart disease, heart defects, congenital defects, status post heart surgery, status post myocardial infarction or heart attack. So, I mean, we still have to address the heart. So what are the complications? In most cases, there are no complications. They're benign. And that's really the good news. But, certainly fainting, if it's really fast and it's sustained, that can happen. Dizziness and fainting. Cardiac arrest, if it's truly cardiac in nature. And if it's AFib, that can develop a stroke. I mentioned that when we talked about atrial fibrillation a few weeks ago. That's one of the most common causes of stroke is atrial fibrillation, and also heart failure. If the heart's beating really fast for a prolonged period of time, it can to go into heart failure just on the basis of a fast heart rate in itself. And I have seen that in some of my patients. So evaluation is pretty cut and dry. You don't do any fancy laboratory tests. I mean, certainly you should do check your thyroid, and check your electrolytes. You want to make sure that you're in balance, because an imbalance of potassium, sometimes calcium, and definitely magnesium can be a trigger for palpitations and arrhythmias. So definitely thyroid, definitely electrolytes, kidney function, and liver function. They're really the important things to check. And normally what I'm going to apply is a monitor on these patients. In the old days, we had these things called Holter monitors. I mean, it's a big clunky thing with a big cassette tape you wore with all these wires, and it gave you like 24 hours, right? It's really not much at all. Well, we've really advanced in recent years. Now we have a new system with like a strip you put right here. It's an adhesive. You clamp on the monitor, and it's totally wireless. You have like a little iPhone with you like this, and you can plug in your symptoms if you have symptoms. There's like a little menu of symptoms like shortness of breath or palpitations or whatnot. And also it's a very brilliant system, and they monitor your rhythm. And I do it for 30 days. Sometimes I'll do it for only 15 days, but the more the patient wears it, the more information I can get. And I want to know what happens when they're sleeping, when they're exercising, when they're eating. And if they wear this for 30 days or a minimum of 15 days, I'm going to get a pretty good idea of what the rhythm is all about. And it clearly has changed how I treat patients, because I want the data. The symptoms are one thing, but once I can correlate with the data, I really got something to work on. And I normally will do a stress test, usually a stress echo, because I do want to rule out something structurally wrong with the heart, a valve problem. It's very important to look at the thickness of the heart, the size of the heart, how well the heart functions. And this is all obtained with an echocardiogram. We do the echo, and then we stress them on this treadmill, and then do a repeat echo to see how they respond to stress. Again, that patient I told you before, my chiropractor friend, I forgot whether during exercise or right at the very end, she went right into the arrhythmia. And again, it was the exercise that precipitated it. So it's an important part of my workup. Now, what about therapies? And this is the important thing. And I really think it's important that patients learn about relaxation techniques. Now, this is how I have dealt with this issue. Most doctors say, I got good news and bad news. The good news is that you got nothing to worry about. Your heart's in great shape. We did this test, we did that test. There's nothing wrong, right? But we still have this problem, right? So you have to learn how to live with it. I don't know about you guys, but like when someone tells me I have to live with something that's distasteful, either physically or emotionally, I say, no, I'm not going to tolerate it. So I'll do everything in my power to not allow that to happen. So I think about that when I discuss with my patients, and I teach them how to breathe. I literally sit down with them and teach them how to breathe. And we're going to have a breathing segment coming up in the next few weeks. I'm going to devote an entire segment to relaxation. But literally, it's learning how to breathe. It's so easy that it's difficult. And you have to find time to do this. I have had people stop a panic attack in its track with palpitations by learning how to breathe. So to me, it's very important. Obviously, reduce stimulant intake, caffeine, alcohol. I mean, if one cup of coffee does it, then you might have to learn how to do without it. I mean, you have to figure out what is your individual triggers. Okay, cold remedies, cough remedies, they are famous for it. Sometimes the asthmatic medications have to be worked around. You have to discuss it with your doctor. And then there's vagus nerve stimulation. Now, the fight or flight is your sympathetic nervous system taking over, and the vagus nerve kind of promotes relaxation and digestion. And I work very hard to stimulate my vagus nerve. So I take cold showers every morning. That starts off my day. After my meditation practice, I take a cold shower to stimulate my vagus nerve. But if you're in the middle of an arrhythmia, you can't like run in the shower, but you can dunk your head in ice water. Most people won't do it, but that can oftentimes stop it. Also, vigorous coughing and gagging, and also bearing down like you're going to have a bowel movement. That's called a Valsalva, and these are all techniques that can be useful in actually stopping an arrhythmia or palpitations. Okay, we talked about balancing your electrolytes, so it's nice to know what your electrolytes are. Hydration is really important, because when your body is dehydrated, your heart has to work that much harder to pump the blood. and that itself can cause palpitations. Decreased alcohol intake. Exercise actually helps to calm the heart. First, of course, you want to get this checked out with your doctor, your health professional, but exercise is actually very useful. And sleep. My God, we don't get enough sleep, and that's really important as well. As far as natural therapies, I kind of use one over and over. I really am a big fan of magnesium. Magnesium is very useful in calming the heart. Also, it's very useful for sleep. There's like 350 some reasons that we need magnesium in our bodies. It's so essential. So, but it does really help with arrhythmia, and I use it a lot to control my patients' palpitations. I try not to use drugs unless it's truly a cardiac problem. Yeah, I know a lot of doctors just throw beta blockers on patients. And I don't like to do that for reasons that I won't get into now. I just try to avoid meds when I can. But I've done really well with magnesium. And sometimes there's another thing another supplement that I use. It's taurine, taurine, which is actually a natural amino acid and can also be useful in calming the heart down. So that's basically palpitations in a nutshell. So now I'm open for questions. So please give me your questions. Okay. Mention how strong is genetics in inheriting high blood pressure and okay. Well, genetics is very big with this is about high blood pressure already. So a little more about high blood pressure than palpitations, but we don't, 90% of patients that have hypertension, we call that essential hypertension. What that means is we don't really know what causes it, but we know that it does run in families, a very strong inherited trait, and that it does become more prevalent as we age. Although I'm seeing teenagers now with hypertension because they're so unhealthy as a whole. Okay, good. Any other questions, please? I have a couple that I've collected questions over the years that people ask me. So, good one. Okay, I saw someone fainted after getting the J&J vaccine. Ooh, what might cause that? Okay, very interesting. These vaccines are a really big thing these days, and it's important because we do want to eventually end this pandemic and develop what's called herd immunity. That would be considered an idiosyncratic reaction, which means it's just individual. It may happen to this person, it may not happen for 5,000 others. It may be, if it's 1 in a million, it doesn't matter if you are the one that's had this, but that would be considered idiosyncratic. Now, you can develop a very small percentage develop what's called a anaphylactic reaction. And I don't know if you're talking about true anaphylactic reaction, which is not just simple fainting. It's like breaking out in hives, itching, and respiratory complications. In fact, they even have respiratory arrest. That's a true anaphylactic reaction, which is life-threatening. And that's been reported. That's why when you get the vaccines, they want you to hang around for about 20 minutes, because that's the danger period in which you would possibly have an anaphylactic reaction. But just simple fainting, it also could have been fear, okay? It could have been a fight or flight. I mean, I'll be honest with you, one time, this is about 15 years ago, I was going to watch the phlebotomist, like stick my arm and get blood out. I said, okay, I'm a big boy now. I'm a doctor. I can watch this. Because you know how you turn your head when they draw your blood. So I watched it, right? And I had pretty easy veins. And all of a sudden, I get really lightheaded. And I'm about to pass out. I was able to catch myself, but it's like, it wasn't the pain, it was the fear and just watching what was happening to me. So I would imagine that's very possible. And that's probably, it wasn't anaphylactic she would take. So it could have been just a fear reaction. And I don't think that's uncommon. But good question. Okay, a friend with AFib and enlarged heart, do they cause the other? Okay, great question. We've talked a lot about AFib. Atrial fibrillation, again, is the most common arrhythmia in those over the age of 70, but you don't have to be 70 to get it. I've seen it, and we had an ablation on a patient of mine who was 29 and who was an athlete. So all bets are off. My two best friends had ablations when they were in their early 50s. It doesn't have to be associated with any structural heart disease at all. We should call this thing called lone atrial fibrillation, meaning we can't find a reason for it. It's just there. Now, I would say now there's probably hypertension, maybe the heart's a little thickened. You don't have to have an enlarged heart. You don't have to have a diseased heart. Um, so the two don't necessarily go hand in hand, but certainly they can. So, and that's why whenever I work up atrial fibrillation or palpitations in general, I'm going to do an ultrasound and probably a stress test and see if there is any correlation. So that's important and good question. Uh, what magnesium do you recommend? I like magnesium glycinate because it's well tolerated, or chelated magnesium. I want something that's well tolerated and doesn't cause diarrhea. Some of the cheaper magnesium is not expensive, but like I forget the one that's in milk of magnesia. There's a carbonate, I forget, something like that. I don't use any of those. I tend to like glycinate. That's the one we offer in our office, and it goes really well, and really has helped with a lot of people. Yeah, I wish everybody would calm down and be pragmatic about the vaccines. I know it is. It's not so much off topic because it is a sense of anxiety in a lot of people, and anxiety is what brings palpitations and panic attacks to play. So, like I said, I've seen more in the last 12 months than I have in my entire career. What are the primary ways would know to not worry? Primary ways would know not to worry. Trying to think what you mean by that. See if you can give me a little better understanding of that question. Okay, I definitely experience heart racing with perimenopause, but thankfully temporary. Very common, and that's why if you go to a standard gynecologist, what they're going to do, let's say you've had a hysterectomy, then there's no need for progesterone. We're just going to give you estrogen because the only reason that your standard gynecologist thinks that you need to have progesterone is to spare the uterus from getting cancer when you give them estrogen. But those of us in functional medicine don't believe in unopposed estrogen. We believe in a balance. And that's where the progesterone comes in. So probably what you were experiencing was a real lack of progesterone. And so that's a really common, again, it took me my anti-aging medical training to learn about what causes palpitations in middle-aged women. I never learned it in my cardiology training, and I had 3 years of cardiology training. So great. It's really great question. Difference between PVC and so PVC stands for premature ventricular beat. So that's an extra beat. Like some people will say, my heart is racing. I'm feeling skip beats or extra beats. Again, that's why I carefully listen to what the patient has to offer before I just give a suggestion. But when you worry about PVCs, first of all, they're basically benign. I've seen them. Being in the Whittier area, I've worked with a lot of students that are on athletic scholarships from Biola University and also Whittier College. So I've done a lot of young people with what happens now with this whole thing with sports and liability and so forth. If they see any red flag like extra beats, or they do a routine EKG, they're going to send them to me. And almost all the time, it's something that you don't have to worry about. But I had a volleyball player from I forgot what country, who she had major arrhythmia. So it can happen, which is why we do have to work it up. So PVCs are extra beats. And some patients feel every extra beat. If I've ever had one, which I'm sure I have, I've never felt. Some people feel every single beat. I have a friend that was really suffering from, he had an ablation for AFib, and then after that, the AFib went away, but then he was having major issues with PVCs. He could feel every one. I can't tell you why certain thresholds, or why pain thresholds or sensory thresholds are more acute in some than others. But when do I worry about PVCs? Okay, if there's 100,000 beats per day, I would say if you have greater than 20,000, that's a lot. And we actually do that with monitoring now. That's one of the things we look for, is how many PVCs are happening, and again, we're talking about over 20,000 in a day. That's worrisome. Otherwise, they tend to be really benign. A difference between PACs and PVCs. Okay, PVCs, premature ventricular beats, contractions rather, originate in the ventricle of the heart. That's the lower chambers. And premature atrial beats arise in the upper chambers. We call the atria. Is one more dangerous than the other? Well, I guess you can say that arrhythmias originating in the ventricles can lead to like ventricular tachycardia or ventricular fibrillation, which are life-threatening. But the upper chambers can also lead to things like a supraventricular tachycardia or atrial fibrillation, which are also a nuisance and need to be treated. So they both can lead to some structural, not so much structural, some arrhythmias that need to be addressed. Okay, chronic use of counter pre-workouts. Oh God, yes. This is a great question. Chronic use of over-the-counter pre-workouts, some seem dangerously strong. Yeah. They've actually been, this is not so much about PVCs or racing heartbeat, but remember those, I've never had the need to do that before a workout. I don't know why some people get some really, they need that energy jolt. I mean, the most I ever did was like caffeine black on an empty stomach when I was dieting for a contest. And that was for fat burning. It wasn't because I needed the energy. But these workout drinks are really, really potent, and they're very high in caffeine and high in sugar. And they've actually led to some cases of sudden death because it can prolong this thing called the QT interval. You may have heard about this QT interval, which is an EKG portion of it. You read it off an EKG when the whole thing about hydroxychloroquine and for the use with for COVID-19. And of course, you wouldn't know if you had it if you didn't have an EKG. Well, they've done some studies of people that had sudden death or, well, survived sudden death, and they had prolonged QT intervals, and they found out that these energy drinks can do it. I will tell you one thing. So I was dieting for a contest about 8 years ago. I was with my oldest daughter, and she gave me a red line, and she said I should take 2. She told me, I'm the doctor, right? Because of my body weight, I was over 200 pounds, right? And I took 2, and I'm on the stair mill, and I'm doing, all of a sudden my heart is like jumping out of my chest. It must have been like, I didn't have my monitor on, but it was like scary. I had to get off, sit down, and I just worked on my breathing for 15 minutes. It was really scary. That was my one and only time I ever worked with one of these things. So yeah, pre-workout stimulants, I would avoid, or I would exercise it with caution, pun intended, because they have been reported, even young people, to cause sudden death and problems. So I'm glad you brought that up. Okay, we talked about BHCs, PVCs. Let's see. Can palpitations accompany a heart attack? Okay, yeah, they can. It's not what usually brings people in the hospital. Usually what brings them to the hospital is the chest pain or shortness of breath or fainting or whatnot. But yeah, if they develop, it could be, and that's when you really worry, because that can be a malignant ventricular arrhythmia, such as ventricular tachycardia or ventricular fibrillation. Well, that they wouldn't survive. But so yes, it can be part of a heart attack. It's not what usually brings them to the hospital. Okay. Do palpitations shorten your life? No, they don't shorten your life. But they are worrisome, and they should be seen. They should be worked up, and they should be dealt with. And in a lot of cases, it is stress related. And again, what we're going to talk about is some of these stress relaxation techniques that I recommend and teach, inculcate to my patients. Okay. Difference between palpitations and arrhythmia. That's a good one. Okay, so palpitations, like I said at the beginning, that is a subjective feeling of your heart beating. Okay. That you feel. Doesn't matter if anyone else sees it or feels it. An arrhythmia is actually a rhythm disturbance that we can pick up on an EKG. So now some palpitations are true arrhythmias, and some are not. So there is a difference. Okay, is L-taurine safe for the heart? Absolutely. I think L-taurine is very good for the heart. It's safe, and it can be useful in calming. I don't exactly remember the mechanism. I don't even know if the mechanism is well known. But I mean, it's not my go-to. I would always use magnesium first. But then I have tried taurine as well with varying success, but lots of times it has helped. Again, a lot of your traditional doctors will go straight to beta blockers. Really? There's some side effects to that. I use beta blockers in people with real heart disease, structural heart disease, patients that are at risk for sudden death. But to give a healthy person, a young person, a beta blocker, when it can slow their heart rate down and decrease their exercise tolerance and make them feel fatigue, I don't want to do that. I wouldn't want that. Okay, can you say something about the long-term COVID symptoms that are happening? Okay, it's interesting. I'm going to be doing a Zoom session in a few weeks from my hospital. They asked me to do this. So it's really important. Now, most patients that survive COVID do just fine, but you have these long haulers. And I first read about it, and I forgot what magazine. It's a pretty well-known magazine. It wasn't necessarily a medical magazine, and they were studying people in England and in the UK that were survivors. And so when you say benign means they never had to go to the hospital. Okay, that if you never have to go to the hospital, that's considered relatively benign. But that didn't mean they didn't have long-term symptoms. So the most common ones are, excuse me, fatigue that lasts for a long time. It can be weeks or months. And there's cognitive issues and people being unable to go back to work because their focusing is just simply not there. So these are central nervous system problems that we don't know all about it yet, or why that happens to some and not others. Now, what concerns me as a cardiologist is respiratory and cardiac. That's why I've had a couple of COVID survivors come to my office, and I'm going to definitely do an ultrasound, an echocardiogram, and see is there any cardiac structural problems, because if you end up in the hospital, about 30% of people are going to have elevated cardiac enzymes that have COVID. And that in itself portends a bad prognosis. And these patients may just do fine, but they may also have residual, what we call like cardiomyopathy, just like a viral cardiomyopathy. It is a virus. So there can be some long-term sequelae on the heart, and also restrictive lung disease. There was one of my cath lab nurses had a very bad COVID, and he was young. I mean, to me, he was younger than me, early 50s, maybe, I would guess. And he was on a ventilator for like 3 or 4 weeks. I mean, he almost didn't make it. And he's still, I recently saw him, he's not back to work yet, but he's I've got some residual respiratory problems, restrictive disease. So yes, we have to really look at that. As far as taurine dose for the heart, usually 1,000 milligrams a day will do it. You can go up from there, but usually 1,000 milligrams is what I would use. Okay, I see a lot of healthy patients in beta blockers for palpitations in the past and no other indications. Any tips for taking someone off? No problem. But there is one important tip. You cannot simply stop a beta blocker. So what I would do, and I've done this to many, many patients, taking them off drugs, especially beta blockers. So what I will do is I'll taper them slowly. I kind of have my own system. Depending on the dose, the higher the dose, the slower the tapering period. But if they're in a low dose, I can taper them within a week. But you definitely want to taper a beta blocker because it can rebound. You can have rebound hypertension. If it's a heart failure patient, they can go into florid heart failure, and they can go into rapid tachycardia and arrhythmias. So it's very doable. It should be done by a cardiologist or someone who really knows the pharmacology of these agents, but it can be done. And I've done it numerous times with success. Great question. Let's see if dosage of magnesium do I suggest? Okay. Really, minimum of 300 at night before you go to bed, because it also helps with sleep. So I like taking magnesium. A lot of the preparations out there are magnesium and calcium together. I don't really like that, because what happens, the calcium can potentially bind the magnesium and render it like not absorbable. So why are you taking it, right? I like taking calcium with food. I like taking magnesium without food, because the calcium is great with food, because it's most foods have calcium in it. Well, a lot of them have calcium in it, especially if you eat greens and so forth. So I separate the two, and I would suggest taking about 300 to 400 at night, depending on your symptomatology. And also, if you have them during the day as well, because most people, I should mention this, most people are really bothered by their palpitations when they're resting. I get this all the time. I hear my heart on my pillow, on my ear, when I turn my, I can't, today I can't explain it, why certain positional changes will do it. But they can. So, yeah, so I would say 300-400 at night, and then maybe another 200-300 between meals during the day. I don't like taking it with food. Topical magnesium, I personally don't have a lot of experience with. A lot of people use it. A lot of functional medicine people use it. Also, Epsom salt, great source of magnesium. So there's different forms. I pretty much stick to what I know works, at least works for me, and that's oral. But the other ones do have some benefits. I'm just not terribly familiar with them. For leg cramps, first of all, number one, hydration. Okay, number 2, potassium, and 3, magnesium. It's usually always electrolyte abnormality, so I always make sure that quinine was a big thing. Quinine used to come in like a supplement, but it doesn't. I don't know, for some reason it was outlawed. I don't remember why, but if you like basic tonic water, it's quinine, and that can help. But it's they're very useful for leg cramps, but still hydration is number 1. Hydration is number 1, and potassium, and like I said, magnesium. Okay, let me see. Okay, these are great. Okay. Okay, I think we're probably good. We did the half hour. Anybody else before we say goodnight? This has really been fun. I think it was really nice doing a change and looking at such a common problem, especially when we're talking about like next month, April is Women's Health Month, so we're going to get more into this stuff. And by the way, June is Men's Health Month. We'll be talking about that as well. Oh, well, here we got, what is the ratio and dosage between calcium channel chloride and calcium gluconate IV? Whoa. Okay. Great question, Roger. I don't even know if I can answer that one. What is the ratio in dosage between calcium chloride versus calcium gluconate IV? Okay. Now, IV calcium is used usually a lot of it. Well, we do use it in our IV drips. I don't know that ratio. I'm sorry. I can try to find that for you. Again, we do IV therapy at HeartWise, and I forgot what we typically use, so I don't know the answer to that. Sorry about that. Okay, great. I appreciate you guys joining in. Join me on YouTube, and also heartwise.com is our website, and Doc Helkin is my Instagram post, and I'm also on HeartWise Fitness and Longevity Center for my Facebook. And other questions you have, feel free to call my office. We do see patients here. And until next week, 2 weeks, I bid you all a good night, and thank you very much. Take care of yourselves. Bye-bye.